Before I start, I just want to also give a big thanks to the team at Motion Spot and Find Enable for sponsoring this session and sponsoring the conference. Ed, can I just thank you personally again to you and the team for all your support you give, both for this event, our most high profile event of the year, but also the work we do and you support us during the course of the year. And I'm delighted that you're able to chair this session. So without further ado, I'm going to pass over to Ed Warner, Chief Executive of Motion Spot, Find Enable. Ed, all yours.
Thank you very much, Jeremy, and thanks for those kind words. Morning, everyone. I'm Ed Warner. I'm founder and CEO of the accessible design business Motion Spot. I'm also the government sector champion for the design of accessible products and spaces. So I'm absolutely delighted to be chairing this session today. And I'm so pleased that it's been so popular. We've had a number of registrants, I think over 200 registrants for this session today. I'm sure a number of people will be catching up online over the next few days and weeks, but thank you for your interest in this session. We've got a really kind of great session and action-packed program coming up, really coming off the back of the publication of the Health and Social Care White Paper last week. And it was so great to see the role that housing has to play within that white paper. And as I'm sure Alex and Dominic will be coming on to talk about, every decision about care is a decision about housing. So it was great to see that role housing had to play. And it's particularly refreshing to see the real focus around designing appropriate housing, personalising adaptations, and giving people the chance to live independently and healthily in their own homes for longer. Particularly for me, I was really pleased to see the real focus around innovation and the intention of the government to really push boundaries, to relook at the approach and generate true scale. And that's what we've so often been struggling with, is how can we bring innovation at scale to this sector? I'm delighted to introduce the speakers who will all give their insight into the role housing has to play in adaptations and helping to keep people safe and independent in their own homes for longer. Our speakers today are Alex Palmer-Wales, who is Senior Policy Officer at the Department of Health and Social Care. We've got Dominic Woodward-Lebihan, who's Head of Adult Social Care Reform Engagement. I will then be speaking about innovation in adaptations in the home and a new approach to personalised adaptations. I'm delighted to welcome Maria Clarke, who starred on Channel 4's George Clarke's Old House, New Home last week, where she'll be talking about the changes she's made in her home for her mum, Margaret. And then last but not least, Sheila McIntosh will be drawing the session to a close, looking at the role housing associations play within adaptations and bringing her significant experience around the DFG to how we can better deliver adaptations and stylish adaptations at scale. As Sally and Jeremy said, there's going to be plenty of time for questions at the end. I would urge attendees to ask questions in the chat box. I'll do my best to coordinate those questions and to field them to the appropriate speakers, and I know Jeremy and Sally will also be on hand to help with that process. I'm going to hand over to Alex and Dominic at this stage, and I look forward to speaking later on. Thanks.
Great, thank you. Well, Ed, Jeremy, thank you ever so much for having us. Could you just give me a thumbs up if you can hear me okay? Excellent. So, my name's Dominic Woodward, and I am the head of the Reform Engagement team here in the Adult Social Care part of the department. I'm joined by my colleague Alex, who's going to talk about some of the specifics. But this is a really good time for us to be here following the publication of the government's Adult Social Care Reform White Paper last year, of which housing is right at the heart. So I think we've got some slides that we're going to share with you. Darcy's just going to put those up. Thank you, Darcy. Shouldn't take too long, but I'm going to start and then I'm going to hand over to Alex. So next slide, please, Darcy. Thank you. So the white paper presented to the House of Commons by Gillian Keegan MP, the Minister of State for Care, last week is titled People at the Heart of Care. And what ministers have tried to be really clear on is that adult social care reform is a journey, and there are some really big and deep-rooted and interconnected issues, many of which you will of course all know about, and many of you will have experienced, and that getting adult social care reform right takes time, and that the publication of last week's white paper was the next big step on the journey to creating an adult social care system that is fit for the future. Back at the start of September, as you might remember, the Prime Minister announced some really significant reforms to the way in which people pay for their care. So we saw a cap on care costs at £86,000. We saw a more generous means test, but we also heard that £1.7 billion will begin major improvements across the social care system in England, and that 1.7 billion is part of the money raised by the new health and social care levy. And the publication of last week's white paper, entitled People at the Heart of Care, was all about how that 1.7 billion is likely to be spent. The picture of the publication is on the right. If you've not seen it, we'll make sure a link comes round after the meeting, but housing and getting housing right and realising the importance of housing in the social care system of the future is a really, really fundamental part of this reform plan. Next slide, please. So this white paper is slightly different to lots of the white papers that are published by central government, insofar as there was a tremendous amount of engagement with the adult social care sector in its development. And what we really mean by that is we mean providers, large providers, small providers, think tanks, local authorities, many different representatives of the housing sector, academics, unions, professional bodies, etc., etc. And what we heard in those conversations, which we first started having back in March, is as well as the individual policy interventions which are required to sort out lots of the issues that exist at the moment, what the government needs to do is it needs to set out its vision for reform. The sector needs an idea of what the government is prioritising and where it wants to get to. And so over the course of the last 6 months, officials and ministers have been trying to do as much of this detailed engagement as possible and get to a place in which we can confidently set out our vision for the future of adult social care. And you see that in front of you on this slide. We think there are three main principles to our 10-year vision for adult social care. Number one, people have choice, control and support to live independent lives. Number two, people can access outstanding quality and tailored care and support. And thirdly, people find adult social care fair and accessible. Now, those are some lofty ambitions. Those are some big objectives. And of course, there's an awful lot that sits behind that. But what the white paper does is underneath each of these objectives to try and make it a bit real, to try and make it a bit more tangible. There are a number of these I statements, which you see made reference to on the bottom right of this slide, which is about when adult social care is good, when it is right, when it works well. This is what it feels like to me. And those I statements are drawn from those who draw on care and support in terms of what good social care looks and feels like to them, to try and give a sense of where we are trying to get to. And in the development of this publication, we work really, really closely with lots of people who provide paid and unpaid care, and lots of people who draw upon it to try and give a really tangible feel to what reform means. So there's a bit about the vision for adult social care, and I'm sure you can see the ways in which housing slots into that. Very happy to take questions on that at the end. Next slide, please. So when it gets to the money, I talked about 1.7 billion at the start. Sometimes these figures are quite difficult to really understand how they break down, and so that's what this slide does. What the government said is that it would invest at least 500 million so that the social care workforce can have the right training and qualifications and feel more recognised for their skills and their commitment. And that included lots of things, including better access to occupational health and support, mental health support, in recognition of the tremendous strain on the workforce as a consequence of the pandemic. And of course, that is very much ongoing, as we all see in the news today. But a recognition there that people are one of the greatest kind of assets in the current social care system. Secondly, on this list, we see at least 300 million to integrate housing into our local health and care strategies. Not going to talk about that because Alex is going to come on to that next, and some other measures in which you'll be really interested too. So 150 million to drive greater adoption of technology. We think COVID has actually, a consequence of it has been strides made in the adoption of technology in the care sector, and we think that funding is going to help accelerate that process. A support service to make minor repairs and changes in people's homes, new support for unpaid carers, some money there specifically for innovation. We heard lots from the sector about the importance of central government supporting innovation where that is proved to work well. Some progress there in terms of supporting better information and advice to help individuals make more informed choices, and some funding to improve the delivery of care and support services, including assisting local authorities to better plan and develop care and support. We can go into any of those in more detail at the end, but that's a breakdown of the funding that was announced last week. Next slide, please. And this is the last one you'll hear from me. So actually, how did we arrive at some of these policy proposals? Well, for each of the chapters of the white paper, so housing most relevant to this discussion, and unpaid care and technology and workforce and others, there were advisory groups of stakeholders who of course work in the sector, providing the department with advice in terms of what they want to see from adult social care reform. And Alex will no doubt talk a bit more about the conversations on that happened about housing there, and indeed many of you may have participated in those discussions. I hope that you did. We worked really hard to make sure that in our 10-year vision for social care, the content wasn't just right, but actually the language we were using was right, because we think that's really important. And we also went out to every single region of England. We know that care is felt differently across the country. We know that the challenges in housing, for instance, and other areas are felt very differently across England, and so we were very, very keen to make sure that we engaged on a local as well as a national basis. So those are some of the measures in the white paper. Their commitment is absolutely there from central government to work as closely as we can with the sector in delivering some of these proposals to make sure that funding is used as efficiently and as effectively as possible, and that it really does move us closer to the reformed adult social care system that we all want to see. Alex, over to you.
Thank you very much. Hello everyone, I'm Alex Farnwales and I'm the Housing Policy Lead here in Department for Health and Social Care. And I'm really happy to be here talking to you. So as Dominic's mentioned, this is all working towards our vision of making sure that people have choice, control and support to live independent lives. And we also want to ensure that wherever possible, care and support can be given in someone's home, because we know that for lots of people, where you actually receive the care and support and where you live, for all of us actually, makes a real difference. And that if you can have care and support in your own home and it's personalised to your needs, it's a million times better for you, and that makes such a difference. And through this white paper process, which, as Dominic said, we've had kind of lots of help from people across the sector, including Jeremy and HousingLIN and some other names I've already seen in the attendees list. So thank you to everyone for your help. It's been really appreciated and a real team effort. We've set out how we want to make every decision about care also a decision about housing. And we want people, wherever they live, to have choice over their housing arrangements, whether that's a new home or an existing home, purpose designed or not, and with access to the adaptations and technologies that help them to live really well. So on this slide, we can see the opportunities for improvement that we realised through conversations, through our kind of knowledge and our research, that there was opportunities for improvement, and they can be broken down into 3 areas. So I'll just run through these. So we've got too many people living in unsuitable homes that do not provide a safe environment for care and support to be effective. Older and disabled people being digitally excluded, and care home staff not being able to access the skills and have the internet skills, and innovation of new models that we could go further, and innovative new models could really transform the way that care and support be provided. I'm here today to talk predominantly about the first one, about the unsuitable homes and the housing element of it, and what can be done there to really provide a safe environment for care and support to be effective, and making sure that, as I said, independence and people are able to kind of really live the lives they want to lead. And then if we move over to the right hand side of the slides, it's the overview of the main policies. And we can see we've announced that, at least 300 million in the over the spending review period to support local areas to provide more support in specialised housing. And then we've also increased our investment in, or furthered investment in, the care and support specialised housing fund, which I know Jeremy will know very well from his time working in the Department of Health and Social Care as well. And then on adaptations, which again is the more detailed focus of today, it's making sure that we can continue to support people to adapt their homes and make sure that that programme can run the best it can. We recognise that although we want people to have more specialised home, most people do live in a mainstream home, and that is where the majority of us spend our time and will end up having care and support. So therefore adaptations is a really key part of that. Next slide, please, Darcy. So in the white paper, and we announced that we want more people to benefit from home adaptations to meet their needs, and therefore we're going to commit a further £573 million per year between 2022-23 and 24-25 to provide funding to local areas to deliver the Disabled Facilities Grant. So that means that the home adaptations are able to reach the people who really need them over this time and can continue happening, being delivered by local areas. But we wanted to go further than that, and we've heard from many people through different conversations that there is more that can be done. So we wanted to take steps to ensure that the grant can reach more people in ways that can benefit them in more than just the kind of ways they have been over the last few years. So to do that, we've announced a new service to make minor repairs and changes in people's homes to help them remain independent and safe. So these small repairs and changes can make a huge difference to people's lives and can really help them stay safe and independent, and it's just minor things that really make a big difference. Also looking at the way DFG funding is allocated to local authorities to help ensure that best alignment with local demand so that adaptations are able to reach those who need them most. We know that, for example, the means test is devilishly complicated and really tough to navigate. So we're considering how to best align the means test with charging reforms and make that as easy to use and as kind of collaborative and working together as possible. And also increasing the amount of the upper limit that a grant can pay for an individual adaptation, because we know there are cases where people need big scale adaptations, and if we can increase the amount that the upper limit can pay, that will make a real difference. On those last three changes I mentioned, we're going to publicly consult on those in the coming year, so do keep an eye out for those, and if you can contribute, please do, because that will be really helpful to make sure we can get a really rounded view. And then finally, these changes will also be supported by forthcoming guidance on the delivery of the DFG to advise local authorities in England how they can effectively and efficiently deliver DFGs to serve the needs of the local older and disabled people. So once that's published on Gov UK, we'll make sure that that can reach everyone. We'll use networks such as HousingLIN and their fantastic social media and e-shots to make sure that that can get out to everyone as well. So that's kind of a bit of a canter through the white paper and the housing and adaptations sections of it. But I really just want to take some time to say thank you for everyone to joining us, and to Jeremy and everyone at HousingLIN for their help and working with us in the lead up to publication of this white paper. As Dominic said, we couldn't have really done it without having the advisory groups and everyone from across the sector who's really helped us. So that's been really appreciated, and hopefully this is just the start, but we want to continue going further and continue doing more. So hopefully everyone can continue to work with us over the next iteration of it. Thank you, and I'll hand back to Ed, I think.
Thank you very much, Alex and Dominic, and fascinating to get some insight into the detail of the health and social care white paper. I'm just going to share my screen a minute.
Just while you're doing so, there have been some questions coming in through the chat box. I'm sure Sally will just remind everybody to cut and paste those questions into the Q&A box, okay? Thanks a lot. Sorry to interrupt.
No, thank you. It makes our life a lot easier at Q&A, Jeremy. So thank you for that. I'm going to follow on from Alex and Dominic's presentation and look at the impact that personal home adaptations have on individuals in the home, and just shine a bit of a light on the type of innovation that can create really safe, accessible and forever homes. Just by way of sort of framing the discussion today and to really give you a bit of an introduction as to why I'm so passionate about this area, I got into this industry just over 10 years ago now, based on the personal experience of our co-founder, James Taylor, an old school friend of mine. We've known each other for over 25 years. James sadly suffered a spinal cord injury in a diving accident, aged 25. He spent 8 months in Stoke Mandeville Hospital and then returned to his flat in Battersea, South London, to an apartment that looked very similar to this. James loved style, choice, materials that were readily available to him. His wife, his girlfriend, now wife, Catherine, was an interior designer, so she had an equally kind of similar eye for tasteful home interiors. But after James's accident, he returned home and needed to make some adaptations to his home, and these were the types of adaptations that were presented to him at the time. And sadly, you know, this is now 16, 17 years on, the adaptations that are still being presented to lots of people returning home don't look dissimilar to the images shown on the bottom row. And it was something James said to me in 2011 that still resonates with me and drives the team forward today. And he said, every morning I wake up and I'm reminded of my condition because the product's around me. And I'm a big believer that if you get the environment right for people, you can really positively impact cognitive and physical health. So that's what prompted James and I to launch Motion Spot almost 10 years ago now. And since then, we've built a really talented team of access specialists and occupational therapists and product designers who are all, you know, really knowledgeable when it comes to what is needed to design really beautiful and accessible homes. But importantly, they're all designers at heart. We don't want anything leaving our design studio without us wanting the product or service in our own homes or lives. What I specifically wanted to talk about today was a very different approach to home adaptations. And this really kind of leads on from something Dominic mentioned about, you know, the pandemic being a catalyst for so much change and potential innovation in this sector. And for us, the COVID pandemic really did provide that catalyst. We realized that, you know, there were a number of disabled and older people who were isolating at home during the lockdowns of the last sort of a couple of years. And we also know that, and knew at the time, that they're isolating in what is often very inappropriate housing stock. Unfortunately, there just is not enough appropriate stock across the UK to suit our aging population. And we know the prevalence of falls. And it was interesting reading the white paper just to see how much there was a focus around falls prevention. And when we looked at this in lockdown of 2020, we realized that, you know, even before the pandemic, 1 in 3 over 65s have a fall every year, costing the NHS £4.6 million a day. And you can only imagine what that number would increase to once the statistics come in about people being at home for longer as a result of the pandemic. So really triggered by some funding from Innovate UK, we decided to launch a totally separate area of our business called Find Enable. And Find Enable was launched in July last year to be a home adaptations service with a difference. And the difference was that this particular home adaptation service would really focus on the person as opposed to the adaptation. And the focus was very much on how we could blend function and form to create really personal home adaptations that looked like they fitted into a home rather than a hospital, that could keep people independent in their homes for longer, and could improve health and well-being, both of the individual using that adaptation, but also carers and family members who are also so impacted by the design, look and feel, and also the performance of adaptations in the home. And what we were really kind of clear on from the outset was we wanted, you know, full visibility of our business model. I think one of the challenges that the adaptation space has at the moment is it's very difficult to truly understand pricing at times. And we wanted a consumer offer that provided a design consultation that was initially free of charge. So individuals could call into our experts over the phone and over Zoom to have a consultation as to what they needed. Our team could then put together 3D visuals and a full quote breaking down the price of every single item in a particular bathroom or wherever the adaptation was in the home. We had to provide, supply of these products across the country. We wanted to make sure that it wasn't a regional-based adaptation service. And we realized very quickly that we needed to put an installation wrapper around this because, for people who are vulnerable in their own homes, they don't want to have to deal with sorting out product on their own and then having to manage a local builder or installer to do it. So we wanted to provide that full turnkey service. And importantly, provide the aftercare that inevitably is needed as part of a home adaptation. There is so much needed at the front end to talk people through what's required, but also when these adaptations go in, how do you use the equipment? How do you maintain and clean the equipment? If there is a part that wears out or breaks over time in future years, how can we support individuals in the home to replace those items? And these are the types of adaptations that have gone in over the last 18 months. And I wanted to just talk you through some of the innovation in this room that we're so hopeful will begin to trickle through local authorities and the DFG process to help sort of improve the design, look and feel of adaptations in the home. This was a particular adaptation for a wheelchair user in central London. The types of designs and products you see here are things like beautiful slip-resistant flooring that looks like a wood effect flooring, but is actually a porcelain floor tile, giving the necessary slip resistance when wet. We specified and supplied a toilet that was positioned at the right height for wheelchair transfer with reinforced hinges on the toilet seat so that your lateral transfer in a wheelchair was easy and it wasn't going to break the hinges with that lateral transfer. So many toilets in homes across the UK are very difficult to flush, and it's small details like that make such a big difference to individuals in the home. If you think about your toilet flush at home, a lot of them require real dexterity to depress the flush. And we wanted to put in a flush plate that was really easy to trigger with a clenched fist or an elbow. Other design features in here are things like the wash basin with integrated hand grips, supporting someone while standing at the wash basin. Products like really accessible lever taps that, again, you don't need real dexterity to operate. If someone has arthritis in their hands, some of these taps are so difficult to operate. The same with shower valves. In the shower, you can see there's a matte black rail there, which holds the shower head in place, but also doubles as a grab bar, supporting up to 150 kilograms of weight, and a really supportive seat in the shower as well. We wanted to design out the shower curtain, so we put in what looks like a fixed panel of glass, but actually bifolds back to the wall when not in use, fully opening up this circulation space within that room for this particular wheelchair user. We wanted to bring a different finish of grab rails to the standard white plastic. There is so much innovation going on in supports at the moment that actually, whether your finish is chrome or matte black or satin steel, it really doesn't have to add significant cost to the adaptation if planned at an early enough stage. And because this was a private adaptation as opposed to coming through a local authority DFG, the individual was able to personalise this particular room. So our client Sophie was absolutely adamant that she wanted to keep a bath, which is shown in the foreground of the picture. We wouldn't normally put a bath into a bathroom into a wet room adaptation, but because of her needs, she found a bath hugely relaxing and beneficial for her health and well-being. So we planned in what is quite a small corner bath, but still delivers the right access for Sophie and just gives her that personal choice that ultimately everyone wants in the home. A lot of what we come across, certainly in home adaptations, is the need for adaptability and flexibility, and the need to future-proof. And I'm really looking forward to hearing from Maria about some of the decisions she made around future-proofing her home in Clapham in London. But this is an example of a bathroom. This is actually a hotel bathroom that was designed a few years ago with technology that gives the flexibility to housing associations and local authorities to adapt bathrooms as and when people need supports and adaptations. So you can see the cover plates on the walls, and in 5 minutes you can hook a grab rail and a shower seat onto those cover plates, effectively meaning that you can prepare the room to suit someone's needs, but not necessarily put that jungle gym of supports in from the outset. And again, if we're trying to make these homes feel less clinical and institutional, having that ability to flexibly adapt a property as someone's age changes, but also how their condition changes over time is particularly beneficial. And we're seeing a number of housing associations adopt this type of sort of flexible approach to both their adaptations of existing and retrofit properties, but also their new build programs. And these are just a couple of other, fine enabled bathrooms that have gone in the last 18 months. So they range from, a huge bathroom. I wish I had a bathroom that size at home. The majority of us don't, but it just shows what a really big space can look like. And importantly, our work is all about how do we deliver access and a future-proofed home, but also how can we ensure that whatever investment is being made in that property can ultimately add value to the property. And what we see so often is local authority DFGs in the past have tended to put adaptations in that have had such a short lifespan because the next resident into that property has wanted to rip out whatever adaptation has gone in there. And what we need to be encouraging everyone across the industry to think about is how we can just be building these design principles in from the outset for both new build and retrofits. The example on the right is probably our smallest space we've ever designed. This is a ground floor cloakroom that was designed, supplied and installed for a lady with MS earlier this year. And just to let you know the impact that that's had on her and the family. So previously she wasn't able to wash at all. She was being bed bathed because that was the only way that she was able to wash. And the only way that we could adapt the home, because we couldn't extend the room in any way, was to think really cleverly and creatively about how we could adapt that ground floor area to ensure that she was able to access the toilet, but also had a level access shower that she was able to wash with carer support in. And again, just giving her that ability to be able to wash what she is able to wash independently as well as with carer support has just really made such a difference to her life. I'd urge any of you who are Instagram followers to jump on the Fine Enable Instagram feed, and I say that not because of a plug to our Instagram channel, but as much as anything, so that you can see the tangible impact that these adaptations are having on the lives of the customers we work with, but also the professionals we work with, the occupational therapists, the clinicians who ultimately will significantly benefit from having more adaptable and safer homes and enabling people to live independently. So why am I kind of presenting this today? The main reason is on the back of the Health and Social Care white paper. There is so much focus in there around innovation and change and looking at a different approach to home adaptations. And we feel that based on the experience we built up over the last 18 months with Fine Enable, there's real opportunity for some of those learnings to be able to be taken by local authorities to help reduce some of the waiting lists for disabled facility grants. We're conscious of the number of people who are waiting for these adaptations at the moment, the pressure on occupational therapists to deliver these adaptations locally. By working with adaptations partners, there is real opportunity to reduce some of those waiting times. But importantly, to Alex and Dominic's point, there is a real opportunity to give then that personal choice for people to keep them independent and safer in their homes for longer, as well as also offer the private paying market an opportunity to to adapt their homes. So many private payers who don't qualify for the DFG are coming to local authorities asking for adaptations, which in turn is slowing up the process for the people who really need it and can't afford it. So having adaptations providers nationally as well as locally will significantly help that process. Sheila McIntosh is going to come on to talk about the role housing associations and other retirement providers have to play within home adaptations, but we're seeing a significant movement in the industry at the moment towards more new build properties being designed to be future-proof, to take adaptations in the future, but not necessarily have them from the outset. And the reason for that is so many, housing with care, but also retirement settings have people moving into them aged, 60, 65 plus, and they don't necessarily need support at that time, but they need the reassurance that the property has been designed to suit them independently as they get older. So we're just in the process of starting to work with housing associations and retirement developers to offer this adaptation service to their residents after they move in, because it's so much better to give that personalised adaptation to the individual rather than putting in grab rails and shower seats from the outset that just follow a standard document Part M approach to the positioning of rails, which so often adds to over specification but doesn't necessarily put supports in the places that people need them. And also, just encouraging these developers to think about how they can bring in a different use of materials that delivers that future-proofed housing from the outset, but doesn't necessarily compromise the look and feel of the home. I'm just sort of drawing to a close in my slides, and I'm going to hand over to Maria in a minute, but I just wanted to sort of summarise where I see the outcomes and the business case for both residents and local authorities by getting these adaptations right at the outset and also delivering them at the right time. There's a real opportunity to enhance access and safety within properties, to obviously improve the aesthetics of the property and give people a greater independence. And when I say people, that's not just the individuals using these adaptations, but they are family members and carers who will benefit from having the right adaptation at the right time. Thinking about products that are easy to maintain and clean is really important, and just giving people that choice and personalisation is very much central to our belief. And the benefits to local authority and wider communities is improving safety and independence for people, hopefully reducing falls and reducing pressure on health and social care budgets, providing options for private payers and reducing the waiting lists for residents who may have slightly more complex needs. And ultimately, we're trying to keep people out of care and particularly out of hospital. And as Alex mentioned before in his presentation, the goal here is to keep people safer at home for longer, because ultimately we don't want to be living in properties that look like this. We want to be living in properties that look like homes. And as Daniel Pinkwater, who's a gentleman in his late 70s said, which I often use, he says, "My house is me and I am it. My house is where I like to be and it looks like all my dreams." And we have a real responsibility as an industry to keep homes looking like homes and delivering for the people we're working for. Thank you. And I'm going to hand over to Maria now to talk through her experience of future-proofing her home for 3 generations in Clapham.
Thank you. Thanks. Thanks for asking me to talk today, Ed. I'm glad to be here. I'm just a bit about our background in this family. My husband and I are both doctors, NHS doctors, and my mother, who's 91 years old, lives with us and our teenage children. And basically the reason I'm talking today is because finally my mother allowed me to adjust some of the pieces within our bathroom to make it safer for her. I basically now full-time carer for my mother. Basically our priorities changed. My husband got diagnosed with cancer a couple of years ago and mummy's needs were increasing, so I'm now mummy's carer and at home all the time. And I hadn't heard anything about Find Enable. My experience of working in the health service, I know how difficult it is to get, firstly, to get the funding to get the adaptations you need within the home, and also getting ones that suit people's needs and helping people to stay at home and the importance of that. Certainly with my mum's case, mummy is someone who's worked very hard all her life, never had any money and never had any money to spend on herself. And so the thought of us spending any money on this bathroom was not going to go through unless I had a reason to push it through. And the reason I was able to push it through is I said it was for my teenage daughter as well to have a bathroom, and they share this bathroom. Heard about Find Enable through our involvement in the television programme, and it really appealed because my mum is fiercely independent. She's got severe osteoarthritis, has had lots of falls, was unsafe in the home, and the bathroom we had before, she was really not able to use at all. The main areas we changed, we had a shower that was a cubicle with a step in, and she couldn't manage the step and was scared when she went into the cubicle, felt very claustrophobic. She couldn't use the shower at all, didn't use that at all. We had also the loo, you can't probably tell from that old photo, but it was one of those push button loos, and mummy's got really bad osteoarthritis in her thumb joints and finger joints. There's no way she could do the pressure of that. So she had the indignity of calling me when she needed me to flush the loo, because the loo function wouldn't work for her. Other things, there were no rails anywhere, and she didn't feel comfortable. I think you'll see there's a chair that we had from when mummy had she had a hip replacement and 2 knee joint replacements, and we used to have that chair in, but mummy hated using that, hated seeing it, because it made her feel very conscious of the limitations of her mobility, which she didn't really want to be thrown in her face every time she went into the bathroom, nor did she want others to have that, what she called that horrible chair in the bathroom. So we were really pleased to hear about the company Find Enable and see the way they've adapted previous projects, and it was really impressive. I'm very acutely aware that, having worked in the NHS, people I work with don't have the funding that I've had to be able to do this for my mother, and so I really hope that a lot of the drive today is to think about the funding so others can have the same access that I've got for help my mother. So if we just talk through what we had done for mummy and how it's worked so well, the shower, we basically got the shower cubicle out, and Ed gave great support to us, came to the home, did a virtual discussion first, lots of suggestions made. The thing that mummy really liked, and I also really liked, is, of course, my mother would benefit from having rails either side of the loo. There's no doubt about it, to help her get up, because she's unsteady when she gets up from there. But she didn't want them. They look clunky. She doesn't want them. She doesn't want that. And it was really adapting what mummy was saying she found acceptable. And it was really great as we went on to work together with Find Enable to get that bathroom as we wanted it. So basically what mummy found really wonderful is to have this shower now. That simple thing of a folding screen door gives much more space, but also mummy doesn't feel claustrophobic at all. There's also a safe handrail around there. If you see the seat, it's so discreet and can fold back up. And mummy really loves it, because it means my teenage daughter also has this kind of cool looking bathroom that mummy accepts the benefits for her, having this lovely room as well, and doesn't feel that it's purely adapted for her, which was one of the reasons she accepted to have this stuff. Other things like the loo, the loo function, we've now switched to this one where we've got, I didn't know what these things were called, but I call them the way you wave your hand in front of it, the loo flush. So mummy now has this actuator plate, apparently it's called, where it's a flush where you're waving your hand in front of it, but also it's lit up at night. So for mummy, that's a great reassurance when she's going at night, and if she can't quite work out where things are, she can go through and find everything easily. So those functions, I could go on, there's so many adaptations in that room. The lower sink she's found really useful. The tap is more rounded, it's easier for her to use. And the towel rail is non-burn temperature. Ed, you can talk more about that, but it has worked so well for us. And the thing that is, I think it looks really beautiful, and we were lucky to do it. But also it's mummy, really acceptable to mummy, because she doesn't feel like it looks like everything's adapted for her, and it really means that she doesn't have the stigma that she feels associated with her disabilities at the moment. So we think it was really a great success for us, for both generations, my daughter and my mother, to share this bathroom, and I just hope that others who aren't as fortunate as me can have access to these kind of adaptations that they need in their home, and also get listened to in the way that we were lucky to be listened to. I don't need to tell anyone in this audience that. I mean, you know, when I was talking to Ed and their team beforehand, they were saying, oh, you talk about the challenges and then advising people about future proofing. I think I don't feel in any way I need to do that to the audience here. But you all know, same as I do, that it's actually what we all would want. We want dignity. We want to accept adaptations at the pace that we want them. You know, people were saying to me, oh, why haven't you got a stanner seat for your mother for the stairs? You know, undoubtedly it would help her, because my mother doesn't want it. We've got a simple handrail, really acceptable to my mother. You all know this from your work. And I just hope that this kind of adaptation is more widely available. That's all I've got to say, really. And thank you for inviting me.
Thank you, Maria. I'm sure we'll have some questions about some of the other decisions that you've made in the home outside the bathroom in Q&A. There's just a short 2-minute video for anyone that didn't see George Clarke's Channel 4 episode last week, which I'll just play now.
Margaret's room didn't need much doing to it, to be fair. But we've given it a refresh by tweaking the layout and some new furniture.
Oh, this is lovely.
She is gorgeous. Go and have a sit in that chair, Mum.
Oh, this is beautiful.
Oh, it is beautiful.
Oh, this is lovely.
Oh, me.
It looks bigger.
It does look bigger. It's just the way it's positioned. It looks bigger.
It's absolutely beautiful.
It is, isn't it?
I tell you what, that's a nice size.
It isn't. Do you like it?
Absolutely lovely.
Oh.
Good night, everyone. It's lovely.
It is lovely.
Margaret insisted on staying in this room because she loves the views over London's rooftops. So it was vital we did something about the tiny shower room that she shares with her granddaughter Sophia, but had difficulty using. Now it's a glamorous marble-tiled wet room, stylish and functional, with a few gadgets to make her life much easier.
I love this. I like this, that you don't have to worry too much after.
Fantastic, fantastic. And look, see that as a seat for you.
It's really good.
You like it then?
Oh, this is a lovely, lovely bathroom.
I think we can say we are flushed with success. Every floor of this 3-story house has been utterly transformed, with spaces that will work for all the family for years to come.
Great. Maria, thank you very much for sharing your experience, and great to have you part of the Q&A in a bit. I'm going to hand over at this point to Sheila.
Right, I'm going to share my screen. Can everybody see that? Can you give me a thumbs up if you can see it? Thank you, Jeremy. What I'm going to do is talk about the role of housing associations in adaptations. And I'm going to follow on from, well, I was part of the team that did the DFG review in 2018. And but what we weren't able to do in that review is look in depth at tenure, and particularly the housing association side of things. And I'm really glad to see the social care white paper come out and have so much on housing, and have so many of the recommendations that we had in that review actually in that white paper. And we know that the DFG guidance is coming out imminently, so that is also going to have a lot of the recommendations that we had in it, I think. So over the last year, we've done some further work to look at the housing association sector. It's been supported by Havinteg, Anchor Hanover and foundations. And we've got a policy report that's due out in the early part of the new year and a summary. But we're also doing some work to produce an online design guide. And, you know, obviously Ed and Maria have shown you what can be done, what beautiful adaptations can be produced. And we can do the same thing using DFG funding. For equivalent sums of money that are spent at the moment, we can produce something that is much better than the medical designs that are produced at the moment. Now, Find Enable is catering for the private pay market, and it will be very useful for you guys who are dealing with inquiries to be able to direct people to that resource. But we know that you need something if you're delivering the DFG, delivering adaptations with people with more limited budgets, then we've got to try and tailor it and see what we can do there. So this design guide is really to help people working in the public sector, people in local authorities and people in housing associations as well. So I'm going to give you just a few headlines from the report. I can't give you any detail, but obviously the report will be out in a couple of months' time, so you'll be able to look at it in more detail then. What I'm going to show you first of all is some of the kind of the findings from the report about what we know about how housing associations are using the DFG and where some of the issues are that still need to be resolved, really. On average, about half of tenants in social housing are disabled or have a long-term illness. And about 20% of those applying for housing for the first time in the social sector have specific disability needs. So it's no wonder that housing associations are using quite a lot of DFG resources because they house such a disproportionate share of disabled people. And about a third of DFGs go to housing associations on average. However, it's not an even spread across the country. You've got some local authorities where the stock was transferred to housing associations, but you've got some areas where there's retained stock. And the retained stock, they don't use the DFG funding. They come under the DFG legislation, but they don't use the funding. And so it's those areas, I've obviously got those areas where the stock wasn't transferred have got less housing association use of their DFG. But some other areas, the stock was transferred, but for various reasons, some housing associations didn't get their own individual budgets at the time of transfer. And therefore they make really heavy use of the DFG. And you can see from that map that relative to stock levels, there are some areas with really, really high usage. North Devon, Copeland up in Cumbria, and quite a lot of areas in the south of England and in London. So that uneven use of the DFG then has a knock-on effect on DFG funding. And it's not really taken account of in the way that resources are allocated. So the DFG delivery is also quite uneven. Some local authorities have got surplus funds, but some can't meet demand because the allocation formula doesn't actually work very well in allocating according to need. And I'm really pleased to see that that's going to be addressed using some consultation in 2022. The ones that the associations that have got surplus funding are no longer means testing in some cases. Many are offering a range of discretionary grants, but they all vary. And staffing levels haven't kept pace with DFG resources either, because the DFG is a capital fund, not a revenue fund. There are ways of paying for technical help and occupational therapy help, but perhaps they aren't used enough, really, and the guidance should help people understand what they can and can't do with the DFG funding. But there are long waiting lists at the moment in some areas, and COVID has led to a lot of backlogs as well. So if we look at it from the local authority perspective, Some housing associations have got brilliant practice. They've got big budgets, they've got their own OTs, they're doing an awful lot of work and making very little demands on the DFG. There's close partnerships with the DFG teams, but it varies enormously. And most housing associations are doing their own minor adaptations, and there was some guidance from 1996 that said they should. But in some places, the budget that was set in 1996 hasn't changed, and we're a long way from there now. We are 15 years later, and they've only got a £500 upper limit for minor adaptations per property. And it means that they're passing more cases across to occupational therapists and local authorities, which they should really be doing themselves. It would be much, much quicker, much better for the tenant for them to do themselves. And it has a knock-on effect. It leads to long waiting times for all people, for all tenures. There also used to be much more sharing of DFG costs. It often used to be kind of 50-50 share when a tenant needed an adaptation. But housing associations have changed enormously over the last 10, 15, 20 years. They've grown in size, and there've been lots and lots of mergers, and housing associations absorbed into bigger groups. And those partnerships have therefore broken down. It's more difficult to have partnerships when each local authority is doing different things, and housing associations cover, in some cases, 100 or more local authorities. The other thing that isn't working terribly well as well is that the application for the DFG is made by the tenant, not by the landlord. And there's often quite long delays in getting consent. And in fact, almost 2/3 of the people that responded to our surveys who worked in local authorities said delays in getting landlords consent for work happens a lot. So it means that tenants may be waiting a long time in a queue for seeing an occupational therapist, and then waiting a long time to get landlord's consent. So there's a lot of delays in the system. It's also, communication's a big issue. There's close relationships with the locally based housing associations, but it's often very unclear who to contact in some of the others, and that leads to the delays. And we've also got some concern expressed by local authorities about adaptations being refused by housing associations, especially in general needs properties, and concern about adaptations being removed at change of tenancy. Very hard for us to get any definite data on that, but we have a lot of hearsay evidence that it's happening. And we've also got some evidence from the English House Conditions Survey. And this is quite troubling, really. We know that the DFG expenditure has gone up enormously. It's doubled since 2015. We know 1/3 of the DFG is going on housing association tenants, but the number of adapted, the proportion of adapted homes in the housing association stock has gone down. And that's unlike other tenures where it's the least level pegged or gone up. In the council stock, it's gone up. So it's kind of like, what's going on, what's happening? Well, from a housing association perspective, they used to have their own direct funding 15 years ago, but they lost that. They've got these restricted adaptation budgets with often a cap on costs. In many cases, they've only got a single member of staff. I spoke to people in housing associations that had more than 50,000 properties and only one person dealing with adaptations. And they're dealing with numerous local authorities, all with different policies, different funding contributions, different paperwork. Some offer a full agency service, some don't. It was very difficult for them to juggle it. And those single people were dealing with complex spreadsheets to try and monitor the different arrangements with local authorities. And I think we also have to realise that the housing association adaptation staff have two hats on. They've got the landlord hat and they've got the adaptations hat, and they're often in conflict. There's such a huge demand for social housing. There's really long waiting lists. So they've had to develop sort of best use of stock policies. And if they find somebody who's a single person or an older person in a family home, there's always the tendency to try and see if they can move that person. And that's maybe where sometimes adaptations aren't allowed. And there's also major concern about water penetration. That's the biggest insurance cost for housing associations. So they don't want to allow adaptations in general needs properties, because when perhaps the older person who the shower was done for moves out, you've then got a family moving in, the shower's going to get a lot more knocking about, and it may not withstand that heavier use. And so we've got to change the way we deliver shower adaptations to make them much, much more robust so that people can get them installed when they need them. If adaptations are refused, it's very, very difficult to see how people are moved when there's such constraints on the stock. There's not that much ability to move. The amount of specialised housing, which I'm glad to see there's going to be more supported housing, specialised housing, but at the moment it's not evenly distributed around the country. And so for some housing associations, they don't have very many places that they can move people to, and not an awful lot of support sometimes to help with that move. So housing associations, they want more consistency in the way the DFG operates. It would make their lives a lot easier. And some of them want a lot more control over the construction process to be able to do things themselves, and so that their repair and maintenance then becomes much easier. For the customer, they're not at the heart of this service. It's a very complex customer pathway. And I'm not going to go into detail about this diagram, but it shows you kind of the handovers that despite staff, I mean, some of the staff that work in adaptations are the nicest people. They are incredibly committed. They're trying their best to deliver a good service, but it's very difficult when there's so many handovers. And the landlord consent often happens a long way through the process. The landlord may not even know the tenant needs an adaptation. They've been referred straight to an occupational therapist. And if there's a long wait for that occupational therapist, it may be a long time before the landlord actually knows what's going on. And there are also issues about, when so many people are involved, about property databases. You know, how are they updated? Who does the updating? And then when somebody needs to move, what actually goes on to the advert for properties? Do they really know how many properties they've got that are adapted? So I think there's a lot that could be sorted out. We made a lot of recommendations in the report, but just 2 of them I've put here. One is to increase the Housing Association's minor works budget so they do more in-house and give a better service to their tenants. And that rather than the tenant putting the application in for the DFG, that the landlord does that application, and then they have more control of the process, and they know right from the start that somebody's needing help. And we really do need good design. And I'm not going to talk a lot about design. Ed's shown you what's possible, and Maria's mother's bathroom shows you how beautiful they can look. But we're still actually, with the DFG, delivering things that look very medical, look like they've come out of a hospital, and design hasn't changed. And we need to make sure it changes, because we need to protect the DFG investment. We need a much more long-term strategic view. And we need to make sure in the social housing sector that adaptations are improved and that fewer are removed. And we need to remove the stigma. We need to encourage people to seek help earlier, rather than having to deal with people at crisis point, when it's much, much more difficult to make decisions. You know, decisions about moving are much harder, and the disruption is very difficult. Or if somebody's coming out of hospital, it's very difficult to discharge them. So we need to encourage that earlier intervention. And at the present time, obviously, we've got, you know, a lot of debate about the green economy. We've got to create a more circular economy. We've got to make sure that adapted homes are recycled and given to the people that do need them, and that we have less waste, that if things are taken out, then there's more recycling. It seems like there's only about a half of local authority areas have a recycling scheme. We need to improve on that. And there's a really useful report that's been just come out from Centre for Ageing Better and UKRI, which is about design and design investment. And I've taken a few quotes out of that report, because I think it's very pertinent to the way design works in the DFG process. That often design is not seen as an investment, it's seen as a cost. And we've got to change that attitude. We've got to have a much more long-term view and a different way of measuring value for money. So it's a longer-term view of things, not this short-term view. And often design is seen as the final touch. It's at the end of the process. And I've had quite a few people more recently have said to me, well, we wanted to do a different design, but by the time we'd done the building work, there wasn't any money left in the budget. So we just did what we always do. And that's not a way to get design embedded into the process. And it's often the OT or the technical officer who is left to make the decisions about design. And they may not, some of them may not be very experienced. Certainly some of them don't have the clout to change the specifications and to actually make those decisions. And technical officers are so under pressure these days, they don't get a chance to go to the trade fairs, to go and see manufacturers and to go and see what the innovation is out there. And so how on earth can they make decisions about what should go in? And I know everybody's doing their best and people have sent me a lot of pictures of what they're doing, but it's kind of like nobody's really understanding the principles behind it. So that's another reason why we're doing the design guide. But bottom right, it needs an investment of leadership time. We need to get strategic managers really kind of thinking about design and what it means for people and giving people much more choice. So I just want to come up with two more slides just to conclude things, because I want to leave plenty of time for discussion. But we do need further changes to the DFG, and I know we've got the guidance coming, and I think a lot of things in there will really help. We've also now got stability and DFG resources. It's 573 million per year for the next 3 years. But that's really what we've got this year. So we got stability, which is great. People can plan for that. It's much, much better than having this year-on-year allocation of funding. But it doesn't take account of the rapid increase in the cost of materials and labour over the last year and a half. I've been told by some people it's like a 20% increase in costs. So, you know, if we want to help more people, we've got to think about those resource levels and whether they can be increased still further. I'm really pleased to see the consultation next year on the upper limit and the means test. That was in the DFG review. I'm particularly welcome the consultation on the way the DFG funding is allocated. The funding formula is way out of date. And as it says in the white paper, we need to help ensure better alignment with local demand. I would urge the departments involved to include the DFG used by housing associations in that formula to make sure that we get an even spread of resources. We still need more integrated teams. We've still got occupational therapists, often in social care, often at county level, whereas the decisions about design and about what goes into people's homes are being made by housing departments at district level. So we need more integrated teams to improve decision making, and we need staff training about design in particular, and potentially about new roles, combined roles. We need training support for contractors. That is crucial. We can't deliver the DFG unless we have enough contractors, but there's an aging workforce. We're losing construction firms, and there's so much demand at the moment in the market that we haven't got enough contractors. And housing associations could play a big role as well in helping to train and support contractors and get, you know, and also help them understand why they're doing things, why design needs to change, how to do things better to make sure that we don't get that water leakage. So we need a lot of training support. The white paper talked a lot about IT and about data sharing and about, you know, using home tech, and including home tech as part of the DFG is the way forward. But we also need to use it to find better ways to communicate with customers and with contractors. We're still using 2D plans and people can't read them. You know, it's very difficult to understand. And obviously with Fine and Able, you get a 3D plan. Even if you go into kind of Howdens or, you know, one of the major retailers, you'll get a 3D video of what the design is for your home, so you can actually see what it looks like and you can have a proper discussion. The DFG is way behind on that, so we need to improve the way we communicate. And video could be used as well to show people how to use equipment, how to maintain equipment, could help again with the contractors helping to do the drainage and make sure that they make bathrooms watertight. And we need better procurement partnerships to get volume discounts, particularly in this time of really high prices. And finally, I'm actually very optimistic. I'm always optimistic that we can get change. Change never quite happens as fast as you want it to, though. But I think COVID has shown that change can happen fast. And on the housing association side, there's much more awareness of disabled and older residents and their needs, which is fantastic. And the Social Housing Charter, the white paper that came out 2020, talked a lot about closer working with tenants and putting tenants at the heart of services. We've got better regulation of consumer standards with more inspection. I would love to see a return to the Audit Commission short notice inspections that we had before 2010. That made an enormous difference to the way that home adaptations were delivered in the social housing sector. We've got a new complaints process, which is great, so that gives support for tenants. And we've got more powers for the Ombudsman services and powers to investigate things more deeply. So I think that could help uncover some of the issues that are going on with the housing adaptations. And then finally, we've got the social care white paper, obviously, with better integration, more specialised and supported housing. We've got changes coming to the building regulations. I would very much like to see adapted and adaptable and accessible homes made a mandatory baseline for all homes. We all need it. None of us know when something's going to happen to us that means that we need a home that will work better for us. And we've got an ageing society. You know, we've got to take on the building industry and make that work. We've got a new decent home standard coming. And we've also got obviously a lot of investment in environmental issues to do with insulation and warm homes. The previous decent home standard did not mention adaptations, despite knowledge that the social housing sector housed an enormously disproportionate number of people who've got disabilities. So the new standard must make sure that inclusive design is used in all homes right from the start when retrofit's done, but that we identify who needs more specialist help. We've got common parts legislation being enacted, but we need to make sure that the responsibility for the funding and maintenance of those common parts is clearly specified. What's the responsibility of the landlord? What's the responsibility of the DFG? And what's going to fall on the tenant? That needs to be spelt out before that gets introduced. We've got the building safety bill. You know, Grenfell showed, really exposed how disabled people have been put in upper floor properties without means of evacuation. We need to address that, but we also need to think about those fire prevention measures that are now going in and make sure that fire doors and things like that are designed properly for people with disabilities. They're very heavy and difficult to open. And again, that could mean disabled people get trapped in buildings. But we've got fantastically the National Disability Strategy. We need to make sure the social model of disability underpins all decision making from now on. We've got an awareness. Let's really make it happen. I think there's a fantastic change ahead of us, but we've really got to grasp these additional issues beyond the social care white paper and the guidance. And that's the end of my talk. I'm going to hand you back to Ed.
Thank you very much, Sheila, and thanks to all speakers today. Fascinating insight from you all. If I could ask you just to turn on your videos for Q&A, and just before we do that, I just wanted to draw out a few summary points from those sessions. Fascinating to hear from Alex and Dominic on the social health and social care white paper. Great to see, choice, control, support for independent lives, very much a focus. The focus, as Alex said, of keeping people at home. Great to see the role that technology has to play within that and wider innovation in the industry. and so good to see carers, the focus be on carers as much as it is on individuals in the home, because those carers, as we know, play such an important role in this process. But fundamentally, just great to see the investment going into this. You know, we're all aware of the health and social care levy, the £5.4 billion being committed over the next few years, and the £573 million of funding every year for DFGs. The government really is putting investment into this, which is fantastic to see. As part of my session, you saw kind of what's possible in innovation, particularly in bathrooms, which are always the room in the home where people want the greatest independence. It's also where the biggest design crimes tend to happen. And I hope that sort of session just demonstrated what is possible. There've been some interesting comments raised on the chat about cost, and I'd really like to kind of tackle the cost point head on here, because, as Maria said, it shouldn't just be the people who can afford this that get the benefit of the right adaptations in the home. So it'd be good to unlock that as part of the Q&A. Maria, lovely to hear from you, your experience, and just seeing that video of your mum always makes me smile. I think someone made a comment on the chat that her smile says it all, really. It doesn't need more than that. And well done for kind of helping raise awareness of this topic by going on Channel 4. We need to be doing, I know it's not difficult going on, not easy going on national telly, but we need to be doing more of it to really raise awareness and to help with the education piece around some of the challenges people face in the home, but also what's possible. And Sheila, thank you for your session at the end. It was so important to have you speaking at the end, because I wanted you to follow the section from Fine and Able to demonstrate that this isn't all about cost, and actually this is all about changing the mindset and thinking differently and having the right design principles and improving products so that we can ultimately improve the design of homes, whether they be DFG funded or private payers. I'd love to keep reusing your quote, if I can, of we need to improve adaptations so fewer are removed. You know, it's improve, not remove, is what we should be focusing on in adaptations, and making sure that we get it right from the outset. Because, as you say, from a green economy perspective, it's just better for the environment, but it's better for individuals in their own homes. I loved your point about design being an investment, not a cost, and very much sort of agree with your view that you know, just accessible and adaptable homes should be mandatory in all new build accommodation. It shouldn't be about, here is a design of a percentage of wheelchair accessible housing and here is a design for non-accessible housing. We just need to do whatever we can as an industry to make our housing more inclusive and future-proof for everybody. So thank you to the speakers, and also thank you to you all for the questions you've raised. I'm gonna open it up to questions now, and perhaps just turn to Alex and Dominic. There've been a number of questions on the chat just about minor adaptations in particular. And there's a question from Janet Sutherland about how the new repairs service can be rolled out across the country. Will we have access to it? There've been a number of other sort of questions around, you know, how the new service, you know, how the minor repairs service will fit in with the existing care and repair services and DFG funding. Are either of you or Darshi, who I forgot to introduce at the beginning, I'm afraid, Darshi, but able to take that one as a question, please?
I can take that one, thank you. And yeah, it's a great question. And it's something that we're going to be doing some kind of rapid work and engagement with stakeholders at kind of different local government levels and different kind of provider levels to really make sure that everyone who really needs it, people, areas, can get this, or will be able to get this funding. So it's kind of, it's a watch this space on that at the moment. It's something that we want to make sure happens properly and in the best way possible. So it's something, yeah, we're going to be doing lots of work in the new year to make sure that when it is rolled out, it can be done in a really good way that has the impact we want it to.
And just following that, Alex, there are a couple of questions around timings of this white paper. And one of the questions that has come up a lot in the Q&A is about DFG guidance, and I know you were on today talking about health and social care white paper. Can you give any insight into sort of timings of new DFG guidance publication?
So I can't give kind of a nailed down timing, but it's something we're working very quickly on with both myself and colleagues from the Department of Levelling Up, Housing and Communities, what used to be MHCLG. So we're working on it very quickly and hoping to have it out in the new year. But I unfortunately can't kind of go down to it will be X or Y, but we're working on it at pace at the moment.
Yeah, understood. And I mean, you know, today was sort of planned to be discussing DFG specifically in the guidance, but actually it's come at a really nice time because of the publication of the white paper last week and also the focus it's had on housing. So we're all looking forward to sort of seeing how the DFG backs up and supports that in the new year. Sheila, some questions for you here, just around, there's one here from Martin Sample. Has Sheila found that the issues she described are exacerbated in two-tier local authority settings? Oh, Sheila, I think you're on mute.
Sorry. There's still an issue, I think, where, I mean, some two tiers are working really closely together with the OTs often based in the districts, or where there's been a combination that actually services have actually joined. So I don't think it's just about two-tier authorities, but we could do better. I think we could definitely do better to join things up, and also to share resources better across authorities, you know, particularly where you've got some that have got, you know, additional funding, but some are really struggling. And some small districts, if they get, say, several children's cases in a year, which tend to be more expensive, and they get, you know, very expensive adaptations that cost 60 grand plus, it's really difficult to afford those. So there are still some issues about that split in responsibility for who does what and who pays for what.
Thank you for that.
Ed, could I interrupt for a minute?
Yeah, sure.
What we've been focusing very much on England, but I'm also conscious that you know, the HousingLIN covers the UK, and I was just wondering if I may ask the question of Sheila whether what the work around DFGs, does that differ from nation state to nation state in the UK?
Yes, it does.
Right. Just explaining that, because there may well be some people from Wales, Scotland, and Ireland. I'm sorry to hijack this, Ed, but I just thought that may be just useful.
No, I was, and I should have spelled out more clearly, I was just talking about England. Scotland has a different system. Wales is it started from the same base as England. It has the DFG, but it's a smaller area with, you know, fewer local authorities. They work much more closely together, and they've retained their care and repair system as well. So there are home improvement agencies in virtually every authority in Wales, and they've changed the way they deliver the DFG slightly. They've split it into three in effect. So it's sort of minor works, medium-sized works, and more expensive, more complex work, which is quite an interesting way of doing it. So there's things we can learn from what's going on. Northern Ireland produced a design guide a number of years ago now, which is very helpful, which helps people actually plan their bathroom design. And we will be referring to that in our design guide. So there's a lot of lessons that we can learn. There's some really interesting stuff going on in Scotland. And Jeremy, you and I are kind of involved in various projects up there on advisory capacity. And yeah, so they are in some ways kind of doing some really innovative stuff that we can learn from. And we certainly refer to them in the DFG review because they've done some kind of long-term research in how the DFG is delivered and trying to bring services together better. So yeah, a lot of learning, I think. And I think we could do more to pull that together, actually, to pull all that learning together and publicise it.
Thanks, Sheila. There's a question here from June, which I'd like to ask Alex. It's about the means test, and you mentioned that you know, one of the goals of the white paper was to simplify the means test. I suppose June's is an observation as much as a question. So she says, the current means test is unfair to working and younger people because it tests income, not outgoings. So often people cannot afford their assessed contribution. There's no point giving more money for DFGs if more people cannot benefit from it. Will the means test be fairer? Are you able to give any sort of insight at this stage as to what will be happening with the simplification of that means test?
So unfortunately, it's also up in the air, kind of with it relating to how it relates to charging form and with consultations to come on it. But we would love for it to be fairer, because I think that is it's a good ambition for it to be fairer and to be kind of more representative. So unfortunately, I can't kind of go into too much more detail on that at the moment. But as I said earlier, hopefully when we are out and consulting on it, that will be kind of we'll welcome all views and all opportunities to comment on it then, if that's okay.
Yeah, look forward to hearing from that when ready in the new year. Thank you. I'd like to bring Maria in at this stage just to give a bit more colour really on what difference the whole home sort of change that George Clarke and his programme did for your mum. What difference has that made to you and the family?
Well, I wish they edited lots out, but I wish they'd shown Mummy's response to the handrail. You know, just something as simple as the handrail in the positions that we've added them in, and the change to the depth of the steps, which she wouldn't let me do before, but did because I showed her the handrail and what it looked like, and simple measures like that. And I noticed somebody in the chats, one of the Q&A, so asked about what about when your mother isn't able to get up the stairs? You know, all very valid. I mean, the beginning of the show, I had the idea, my teenage son, kicked my teenage son out of his bedroom, put him in the back bedroom, which we did. And the master plan was, it'd be much better for Mummy to be in this bigger room, much lighter, have an ensuite in there. And we were going to ask you guys to fit everything in there. But Mummy didn't want to be on that level. So I think, you know, of course, it's fair comment to say that. And the answer is, I don't know how my mother's function is going to alter over the years or the pace of it. But I do know what is acceptable to my mother at this time. And I do know that when that other time comes, we will then face that and adjust accordingly, you know, whether it be a standard stair lift, I don't know, but it's certainly something that we very much considered being on a lower level. But as I said before, it's about, and that's what I loved about Ed's team, they listened to what my mother wanted, and not necessarily the choice that we would have made at the beginning. For, you know, I would have preferred my mother to have had a bigger room with an ensuite that all adapted for her now at a lower level. But you have to adapt to what the person wants and what is acceptable to the person who's actually using it. And, you know, so I did it for my mother and the choice of my mother. But in terms of the other adaptations in the house, it was just really simple things like, you know, the stairs, the handrails, very basic stuff. But she feels so much happier just watching her mobilize around the kitchen and down between the kitchen to the loo downstairs. We've adapted in the same way. It's huge, you know, huge. So, you know, I can't emphasize enough how helpful it was having support all along the way, and seeing things that looked actually much more acceptable to my mother and unobtrusive. That was the main thing.
That concept of unobtrusive is so important, and is really connected to what Sheila was saying about building in some of these more supportive design features that don't necessarily look like a support for later living, but are just good practice for new build housing, as well as retrofits. I'm keen to sort of explore the cost question. There was a comment raised in the chat about, you know, fine enabled designs are fantastic, but I guess they are cost prohibitive to many and would not be affordable under the DFG. And I'm really keen to sort of explore that, because you know, the cost of fine enabled products as a starting point for everything that goes into a standard bathroom is from £4,000. So these aren't £30,000 bathrooms.
Okay.
And if you think about the current average investment for a disabled facility grant bathroom adaptation, a fully installed bathroom is anywhere between £5,000 and £9,000, dependent on where the geography is. And within that budget is obviously product as well as install. So to Sheila's point, if you can plan the right sort of product mix at an early enough stage, and also if local authorities can come together to get the volumes up across the country so that manufacturers can help bring the pricing down, there is absolutely no reason why the design principles and products that you've seen in Maria's home and in other fine enabled bathrooms I showed couldn't be adapted across across DFGs. And Sheila, I'm just keen if you wanted to sort of add anything to that, because I know you're very passionate about bringing this better design to DFG.
Muting myself. I think that we could do much better within the same cost frames that we operate at the moment. But we need better procurement, and we need that anyway. I mean, not just for bathrooms, but for everything. And it's where bringing in the social housing sector is really important, because they have the volumes. The DFG, certainly in some authorities, their DFG budget isn't that great. They can't generate good prices, but if they worked in partnership with some of the social housing providers, they could get those volumes. And also, but I think it's this changing culture is just as important as the funding and the training and the support that people get. And I know, having talked to quite a lot of the manufacturers and the suppliers of products, they're all really, really willing to work with people, to work with the technical officers and the people who are specifying the work. They will produce things if they know that there's enough volume there. And there's already an enormous range of products already out there. It's just getting that knowledge to the right people. And so it's not really about price. It's about knowledge, support, and changing the culture. And changing, perhaps more difficult, is this sort of idea that the DFG is welfare. And we've got to change that attitude. It's people's homes. This is about investment in the person, in their well-being, investment in our national housing stock. And we need to make sure it's all going to last much, much longer than it does at the moment and isn't ripped out. But we've got to get away from this sort of minimalist welfare mentality and change that culture.
Can I just come in on there, Ed? I think Sheila's absolutely spot on, and that welfareism also reinforces dependency. But what Maria's shown is how this can actually create both an interdependency in a multi-generational household and also independence with the individual in their own space, so they can create that home and living ability and have that livability as opposed to a disability.
Thanks, Jeremy. I'm going to begin to sort of draw things to a close, and I've got sort of just some final questions for each of us, our speakers, if that's okay. But I suppose one for Alex and Dominic, conscious of the attendees on this session today and those that will be listening to the recording, particularly who are all sort of housing specialists. Is there anything that you would want them to be doing now this white paper's been released? If you have an ask of them, what would it be to help and support this white paper?
I think that our ask would just be, as I think Dominic and I have both said, this is stage 1 or stage 2 on a journey, and kind of keep working with us as we move forward, and help, and also keep kind of innovating where you can, and try and really consciously to think, what could we be doing? This entire session has been really, really interesting, and think about what could we be doing it better, and how can we really kind of make sure that we can help people keep their independence. And just that's where I'll end. I think really make sure that people can keep their independence, and what more can we be doing? I don't know if Dominic's got anything you want us to add.
I will add only that I would re-emphasise that housing is a really fundamental part for us and for central government of getting adult social care reform right. And precisely as Alex said, we think this is an ambitious programme, but it's one that will take time and effort, and things won't always go smoothly along the way. And so your patience and your continued expertise is really what we need. So thank you.
Thank you both for that. Sheila, your previous comment about DFG not being about welfare is getting lots of positive comment on in the chat, and thank you for all of your thoughts as part of Q&A. Just a sort of last question from me. You mentioned your ambitions for decent home standard and for adaptable and future-proofed homes to be incorporated into that. If you were to have sort of a message to government, having some government representatives here, what would you want to see from decent homes standards?
I want to see that disability and aging is part of the whole way that document, when it comes out, is structured. That we've got to accept that social housing, which is where decent homes is going to be applied, is where the majority of disabled people live, and the population there is aging too, and they're also aging. We know that people who are on lower incomes have lower life expectancy. They also get frailer, 10 years younger than people in wealthier groups. So we need to get that housing stock really working for the population that it houses. And if we've got, a fifth of new applicants for housing having very specific disability needs, they need to be able to get properties that work for them. And we've got a situation at the moment where people end up accepting any property just to get into social housing. And then they often can't move because they've got themselves stuck. And each property should work. And so we need an inclusive level of design in all retrofit and all new build in that sector. And it's got to be written into any legislation and guidance and regulation. And that's all I can say. I mean, it's just got to be a fundamental part of it. But the problem is that the people who work on those things often don't come into the discussions like this today, and they don't understand what's needed. So we need to make sure there are the right representatives on those panels who do understand these issues.
Thanks,
and so hopefully that will happen.
Yeah, and I wholeheartedly support those views. I think just on that comment about there's not necessarily the right people in the right place listening to that, I'd say that there is an opportunity from today's session for this session and recording to be shared with members of government that are looking at this guidance at the moment. And certainly in my role as Government Sector Champion for Design of Accessible Products and Spaces, we report into Cabinet Office cross government functions. So I'm really keen to kind of pick that up with relevant people across government, so that, as you say, we can be designing more inclusive homes for both retrofit and for new build. Maria, perhaps if I could come to you for final word, if that's okay. If for someone that's been through it, what advice would you give to other people considering adapting their home?
You listen to the person who you're thinking you want to make the adaptations for. That's really it. And my mother was someone quite difficult to persuade to let anyone spend any money on her, having no money all her life. But persuasion and listening to the person who wants. I listen to my mother. I would do the same to anyone in my professional role as well. I listen to the people I'm working with. I want to listen to what they need, not what I think they need.
Great, thank you for that. Again, wholeheartedly agree with putting people at the heart of housing. Thank you all to speakers. Jeremy, I'll hand back to you to close.
Ed, can I also thank you for chairing such an excellent session, and likewise to each of you for all your contributions, both professional and personal. It's been a really illuminating and inspiring session. I could go on another 5-10 minutes easily, but I just wanted to highlight a couple of things. Several people in the chat room and the conversation we've just had have made a very clear link between the relationship between housing, health and social care, that integrated approach, and Dominic set that out very eloquently earlier on. We're going to be exploring a little bit more of that tomorrow with Lord Crisp, who, Maria, you may remember, he was the chief exec of the NHS, now a crossbencher in the House of Parliament, who's going to talk about the relationship with health and housing. So please do join us tomorrow afternoon. But also something for the civil servants, Ed, that you mentioned. What's really encouraging, I think, is that the current Secretary of State at DHSC is also former Housing Secretary of State, and perhaps we can use his understanding of the housing market and the issues that he did so eloquently in terms of trying to look at boosting growth and improving the quality of housing through things like the Good Home Inquiry and the Home of 2030 competition, to think about how that can apply to adaptations and accessibility going forward. And I'm sure some bilaterals between him and the Secretary of State at DLUC would be appropriate. And I know civil servants behind the scene are working very hard on some of this. But finally, can I just thank you, Ed, at Motion Spot and Find and Able for supporting the HousingLIN and enabling us to put this session on. We've had a tremendous interest in this, and we will be circulating the recordings and some fantastic contributions from everybody. Can I wish every season's greetings, and do join us again at one of our other HousingLIN Summit sessions if you've got time available for the remainder of this week. Thanks, everybody.